Hi, I'm Dr. Justin Chandler, a neurovascular neurohospitalist, a brain specialist, and I get asked all the time about concussions. So let's talk about concussions. Did you know that there's over 3 million sports-related and recreational concussions that are diagnosed each year? And 300,000 of those are directly a result of football. I know that the concussion playoffs are getting ready to start with the NFL, and so we're probably going to hear even more about them. It's important that we understand these, especially for our own children and for young athletes that are beginning to learn how to play these sports safely. It's interesting to know that 5 out of 10 concussions go unreported, and we're going to talk about how to report a concussion directly to a physician and what you need to include when you're talking to a doctor about this. 2 out of every 10 high school athletes will suffer a concussion each year. To me, those are alarming numbers, and they're numbers that we should try to prevent. So let's talk about how we diagnose a concussion so that when someone that's had one comes into our office and talks to us, what we actually need to know, how you can help us, and how we can make the fastest diagnosis possible to get your son or daughter back to being who they are. When it comes to the diagnosis of concussion, there's really 2 things that happen here. First off, to diagnose a concussion, you need 2 experts. You need the physician, and perhaps even more important, you or your child. You will be the expert in telling us the symptoms and the signs that you are feeling after your concussion happened. And for us as the expert, particularly as neurologists, we need to listen to those things. And it's our job to listen and to ask the questions that are going to lead us to the diagnosis and help us find the treatment option that's going to be best for you or your child. Typically, we're going to start off and want to know about symptoms and signs. There's a difference between these 2 things. Let's talk about them. As the doctor, as the brain specialist, I first want to know what symptoms your athlete or you are having when it comes to concussions. Symptoms are the things that you are experiencing. Do you have a headache? Do you feel fatigued? Is your brain slow? Do you feel a sense of brain fog? You can't think quick enough. Do you feel nauseated? Do you have ringing in your ears, or tinnitus, as the doctors like to call it? These are all things that you are going to report to us as symptoms that you may have. In addition to telling us the symptoms, it's going to be critical that you also give us the history of the impact. We will talk more about that later. When it comes to the signs that you need to tell us, these are things like, did you experience vomiting? Did you lose vision? Did you see sparklers, floaters? Did your vision completely go out? Did it zone or tunnel in? Do you have vision loss now? Are you still vomiting periodically? Did you get double vision or diplopia, the term that your neurologist is going to use? Did you have abnormal eye movements? These are things where your eyes may not be working in tandem together when they're moving. Was one eye off the wrong direction? Or did you have a beating of your eye movements called nystagmus? Was there a loss of consciousness? These are all signs and symptoms of a concussion that you need to let the neurologist know. Along with these symptoms, we need to know the duration or how long these symptoms have been going on. Was it only temporary that I had a headache? Did my vision loss completely recover? Did the ringing in my ears go away quickly within 5 to 10 minutes? These are the important things that I want you to be able to communicate to us as a medical team so that we can then work on understanding the science behind a concussion. Now that we've talked about the signs and the symptoms of concussion, let's actually talk about what a concussion is. I think the easiest way to think about this is to think about the hit or the impact itself. For the longest time, and what is typically believed amongst everybody, is that a concussion is a brain bruise. That's not what actually happens here. It's quite a bit different than that. And so it's important for you to understand that a concussion And the reason you feel fatigue and the reason you have a headache is because there is a massive energy deficit that happens when your brain gets struck. The reason we talk about it this way is because a lot of people ask us, well, what did my head CT scan show? What does the MRI scan show? It shows a normal brain when someone comes in with a concussion. And that's because a concussion is a functional and not a structural problem with the brain. Head CT scans and MRI scans, they show us the structure of the brain, the scaffolding, what it looks like, the brain itself. Those don't show us the function of the brain. And so what we really need to understand is that rather than being this big impact like a bruise, is that there is an acceleration and a deceleration that happens in the brain. When this happens, that leads to massive abnormal stretching of the neurons, particularly the part of the neuron that sends the signal the fastest. That part of the neuron is what is called the axon. The axon is the long tail of the neuron that the impulse goes through, and it's wrapped with insulation or bands around it. In between this insulation that is called myelin, or this myelin sheath, there's little spots that don't have any myelin. Those are called nodes of Ranvier. They are there so that you can get the signal fast. It can jump from one to the next. That's why our brains can think so quickly. They can move so quickly. We can see things so quickly. When you have a big impact or a hit, this whole axon gets stretched. And when it gets stretched forward and then backward, as the brain goes forward and backward from a hit, or side to side, or even rotationally, which can be really dangerous, that causes an abnormal ion exchange. You have to have ions, or potassium, sodium, and calcium, that move from one side of the membrane to the other side of the membrane in the neuron and in the axon itself in order to generate thoughts, in order to generate movements. Or if you want to whittle it really down, this is the process of what's called an action potential. When you get hit, or when you have this stretching that happens, potassium rushes out of the cell. And when that happens, sodium rushes in and calcium then rushes in. This destabilizes the neuron. It makes it so the neuron has now had a massive firing. And if you think about it, a hit or a concussion in the brain does this with all of the brain cells. It's not just one neuron that's firing at a time to control a specific movement. The whole brain has neurons that get destabilized. When those neurons then become destabilized, we have to re-equilibrate or recalibrate these ions so that we can think clear again, so that we can move clear again, so we can speak clear again. And this causes an inability to restabilize because the whole brain has had this happen. Not only does it lead to a poor ion exchange, for me as a vascular neurologist or a stroke specialist, it's important we talk about this as well. This changes cerebral blood flow. That stretching happens not just to the neurons, it also happens to the blood vessels in the brain. In fact, if you think of a high-velocity motor vehicle accident, when that happens, the kind of concussions we typically see then end up having hemorrhages or brain bleeds as a result. And that's because blood vessels are involved as well. So you have a destabilization of the neuron because there is an abnormal ion exchange, and your cerebral blood flow also gets adjusted. So now you're not getting the blood flow that you need to the brain. And this is a concussion. It is when you have a massive energy deficit because of cerebral blood flow and abnormal ion exchange. This abnormal ion exchange, this change in your cerebral blood flow, makes you feel a headache. It makes you feel tired. It makes you feel fatigued. If it happens in the occipital lobe, it makes you see stars. It can make your vision tunnel out so that you can't see. If it happens hard enough, it can make you completely lose consciousness. And if you lose consciousness, that can be really dangerous because then you're not thinking, you're not protecting yourself afterwards. And in fact, one concussion can lead to another concussion. And if you have a second concussion shortly after having a first one, you can get what can be a fatal syndrome called second impact syndrome. Second impact syndrome occurs when your brain has not had enough time to start to restabilize all of the neurons that have been affected, and you get another impact that stretches everything again, and it further messes up all of the ion gradients. That can happen to the point where your brain doesn't recover, and that can be fatal. Though second impact syndrome can be fatal, oftentimes it's not. In fact, you'll see a second impact occur all the time in boxing and in MMA. You'll see a fighter get hit once and they will get dazed. They become wobbly on their feet. They're starting to try to get themselves out of danger. But you'll notice that first punch, the first hit, the first kick, that usually isn't the one that knocks them out. It's the second hit that does. And you now know why. The first hit destabilized things. The neurons started to restabilize. The blood flow started to go back in. But if they get that second hit too quick, it can't do it. They lose consciousness and they're out. So for second impact syndrome, we're talking about the very rare circumstance, the rare instance that the first hit was so hard that it stretched things so bad that it caused a massive abnormal ion exchange, a massive change in the cerebral blood flow. And then the second hit did it again with the same force and the same intensity that they're not able to recover from. An important thing that I want you to understand about this ion destabilization is the fact that when people get a concussion, they can then have a seizure that happens right afterwards. If you'll notice, all of these ions have an electrical charge to them. And your brain deals with hormones, it deals with minerals, it deals with cerebral blood flow, it deals with oxygen, and it also deals with an electrical current. And when you have a massive dump of ions that have electrical chemical gradients in them, it can cause a massive seizure in someone. And so if someone has a seizure after they've had a concussion, that's also something we need to know. Seizures can oftentimes be even more dangerous in the setting of a concussion because it means the brain fired so hard that it caused a physical manifestation. And when someone is seizing and shaking, if it's a generalized tonic-clonic seizure, or what is referred to as a grand mal seizure, it's not only their muscles that are shaking and tightening up in their arms and their legs, their diaphragm tightens up and gets locked. And if your diaphragm's not moving, there's no oxygen exchange. And if there's no oxygen exchange, then that means that your brain that has just been damaged with abnormal ion shifts and decreased cerebral blood flow is now not getting the oxygen that it needs to survive. That is why it is critical that in any concussion, you see a specialist or it gets taken care of right away. Now that we've talked about the science of concussion, now that we've talked about the actual hit and what happens to the brain when the stretching of that axon occurs, now we need to talk about two specific things. One, we really need to talk about children. Children are at the greatest risk of suffering damage and the harsh effects of a concussion because they have small necks. They're not as strong. They don't support the head as much. In fact, you may have seen one of these little football players get tackled, and when they get tackled, their shoulder pads hit, and then their head follows them all the way down to the ground and then back up. So it's not just the head that children get affected, it's also their necks that can be damaged. Their heads are big. They're heavier in proportion to their neck strength. And their myelin sheaths. They have undeveloped myelin. Remember, myelin is the insulation that wraps around the axons of the neurons in the brain and in the spinal cord. And because that myelin isn't fully insulated and isn't as thick as it is when they become adults and get developed, it leads to easier ion shifts in exchange and puts them at a greater risk for damage. And so the effects of the concussion can be even more severe, long-lasting, and in some cases, cause permanent residual damage. We want to avoid concussions in children as much as possible. But when they do happen, and if they happen, we need to know what we do next. You've had a concussion, your loved one's had a concussion. Now what? Well, the first thing you need to do is you need to stop playing. Don't go back into the game. Make sure you're evaluated, whether that's on the sideline by a trained professional or, even more importantly, by a doctor or a specialist. You need to be evaluated. In fact, the number one predictor of recovery, of how quickly you will get back, how fully you will get back, is how long it takes you to see a clinician that knows about concussions. They can help guide you through the processes and the steps to help you recover. But let's talk about just a couple things. First off, if you've had a concussion and you're meeting with the specialist or the expert, hopefully it's a brain doctor, discuss and share the symptoms like we've talked about. Give them all the history and the detail you can. And then do your part. Eat healthy. Why? Well, because we talked about sodium and potassium and calcium. And we talked about blood flow changes to the brain. The more healthy you eat, the better the fuel's going to be for your brain to re-equilibrate, to get itself back on a normal track for you to recover quicker. Get moderate sleep. This myth that, hey, don't let them sleep for 24 hours, keep them up. Don't sleep deprive a concussed brain. The brain needs some sleep to help it recover, and a moderate amount is good. We don't want excessive or overt sleeping. We still want the brain to be engaged. It's okay to go on a walk. It's okay to engage in some light exercise after you've had a concussion. It's okay to get things flowing and start to get things reestablished back to their normalcy. The thing you do need to avoid, though, is overstimulation. Don't put on the headphones. Don't sit in front of a computer screen and play a bunch of video games. That's probably unhealthy for the brain after a concussion and may prolong your symptoms or even make them worse, or in some cases, can make them recur. So I hope that you now know the numbers, the signs, the symptoms, and the science behind concussion. And on top of that, I hope you're able to know a couple of the things that you can do to help you recover from a concussion. Insider opinion. I get asked it all the time. So, should my kid play football? I gotta tell you, as a neurovascular neurohospitalist, as a stroke specialist, as a brain physician, the answer is no. Absolutely not. As a parent, someone who's played football, character development, sacrifice, teamwork, unity, learning how to push through things that are really hard, really tough. Hey, I think it's a decision you and your child are going to have to make together. Again, I'm Dr. Justin Chandler, neurovascular neurohospitalist, brain specialist. We're going to be putting out videos weekly. I really hope that you enjoyed this, and I hope you learned something. I hope that you will take the knowledge that you gained from what you watched today and share it with other people. That's going to be beneficial to us. And you don't want to miss what we're going to talk about next week.